The importance of hand hygiene cannot be overemphasized when it comes to patient safety. When you look at the marking criteria closely, you will see it specified towards the end that hand hygiene verbalization is acceptable. This is to tell you that it is important for you to acknowledge the moment of hand hygiene and to do it appropriately. This statement is made because NMC understands that towards the end of your procedure, there is limited time for you to conclude everything, but they expect you to at least verbalize that you are going to perform your final hand hygiene before you leave the patient. If you had made use of any PPE, you're expected to verbalize that you're going to dispose of your PPE into the clinical waste bin and then you perform your final hand hygiene. Verbalization is usually acceptable. Before explaining the different techniques, I would like to mention this. During your OSCE exams, the first hand hygiene you perform and also to demonstrate them. Subsequently, you can state that you are going to perform the 7 steps and then you don't necessarily need to state the 7 steps, but make sure you perform it. Let's look at the different techniques of hand hygiene as it applies to OSCE exams. The 2 major techniques of hand hygiene that applies to OSCE includes hand sanitizing technique and hand washing technique. As a way of recommendation, I will suggest you use hand sanitizing technique. The first one we'll be looking at is the hand sanitizing technique. In this technique, all you need is the hand sanitizer. This is how you perform the technique. First, you apply an ample amount of gel in your palm. Following the 7 steps of World Health Organization, you perform your hand hygiene, palm to palm, right palm over the left dorsum, vice versa, fingers interlaced, fingers interlocked, rotational rubbing of the thumb, tips of the finger to the palm, rotational rubbing of the wrist. When I dry my hands for 30 seconds, my hands are clean. The next technique I'll be looking at is the hand washing technique. As a way of recommendation, I would prefer the previous one because it's faster. Also, when you need to perform hand hygiene at specific times within a procedure, hand sanitizing is preferable. For the hand washing technique, first of all, you turn up your tap if it is not the type that dispenses water automatically. Wet your hands, apply soap, perform hand hygiene following the 7 steps. Palm to palm, right palm over the left dorsum, vice versa, fingers interlaced, fingers interlocked. Rotational rubbing of the thumb, tips of the fingers to the palm, rotational rubbing of the wrist, and then you rinse your hands properly, getting rid of the foamy soap on your hands. Once you are done rinsing your hands, you grab a paper towel or any towel available. Paper towel is preferable. And then you dry your hands, dab your hands dry. And then you dispose of the paper towel into the domestic waste bin. Your hands are clean. This video was useful to you. If you like this video, please do well to give it a thumbs up and share this video to someone who is preparing for OSCE. You may not know the person, but just keep sharing the link. It will definitely get to someone that needs this video. And until then, I'll see you in my next one. Bye.